Good morning, good afternoon, good evening. Thank you so much for joining us today. We are together for our first ever Evidence Spotlights in Dialogue. My name is Rinki Deb. I am the Director for Science Research and Market Access at Vestergaard. We have quite an international presence today, so some of us have woken up very, very early to join. Thank you so much. But we are joined today to talk about spatial emanators and vaccines. So we have two panel members today who've kindly joined us and have also collaborated with us in developing the actual Evidence Spotlight document. If you've not seen them already, there was a QR code, but we will also share the links so you can access and read them afterwards. But if I can start off, let's start off with an easy question. So Corine, would you mind introducing yourself?
This event. So it's a pleasure for me to be part of this. I'm Corine Ngufor. I'm a medical entomologist, and I work with AIRID in Benin and also with the Liverpool School of Tropical Medicine. So my research focuses mostly on the evaluation of vector control products at different levels in laboratory, semi-field, and also in community trials. And I've worked on a lot of nets, but also I've been involved in research on malaria vaccines. So I'm happy to be part of this. Thanks a lot. Yeah.
Thanks so much, Corinne. And Neil, would you mind introducing yourself today, please?
Hey, I'm Neil Lobo. I'm an entomologist at the University of Notre Dame, and I also work with the Malaria Elimination Initiative at UCSF. I work in understanding systems. Though some of my recent work has focused on spatial emanators or SEs, I'm more broadly interested in how different interventions function both individually and together, because no single tool will solve malaria everywhere. So understanding how these interventions sort of complement each other and where each one may provide the greatest benefit is sort of becoming increasingly important for malaria programs.
Thanks so much, Neil. And if we stick with you, can you summarize for us what the Evidence Spotlight covers and what are the key findings that we're trying to make sure our audience is able to take away from the document?
Cool. So I think the most important message from the spotlight, the evidence spotlight, is that malaria control is no longer about choosing between interventions. It's sort of about understanding which intervention or combination of interventions work best based on the local drivers of transmission and gaps in protection, like what's happening locally. The evidence shows, it demonstrates that bed nets remain the foundation of malaria prevention because they reduce both human exposure to mosquito bites and malaria transmission across communities, both individual and community protection. Vaccines provide an additional layer of protection, and spatial emanators provide an also another layer of protection by reducing the chance that mosquitoes successfully locate and feed on people in the first place. One of the most interesting findings is that both the vaccine and spatial emanators, the evidence for them comes largely from studies where bed net coverage was already high, right? So all this protection was over and above what bed nets were already protecting.
Thanks, Neil. And there's been quite a lot of work in Mali, for example, as well. So it's a balance of what evidence is currently out there and what has been able to show epidemiological impact versus what is yet to be shown. So are we saying that there still needs to be more evidence generated to support spatial emanators as well? Or the deployment of it, should I say?
Yes, so we have data that in controlled randomized controlled trials that it works from Kenya. We don't have implementation data, so we're looking forward to implementation studies as in how to get this paradigm to communities well, how to get them to communities so we can protect them efficiently, because real life is not the same as a randomized control trial. It's very, very different. So we need that evidence base to understand how to get this effectively to communities to protect them. Yeah.
Thanks, Neil. And Corinne, I know that you have done some testing with spatial emanators. Would you like to comment a little bit about on the subject as well?
Yeah, and thank you so much. I can say for spatial emanators, yes, we have this conditional recommendation from WHO, which shows that they are effective when used in addition to ITNs, and that's what we have so far. We do not yet have evidence of their use, their effectiveness on their own. So, but we're hoping that that kind of evidence could also be generated at some point. But right now, it's very clear that even the trials that were conducted in addition to ITNs. So it would be wrong to maybe assume that we can deploy special emanators on their own and still get this effect. I think for me, it's important that based on the evidence that countries really understand this difference and that they are not pushed to maybe only deploy special emanators on their own, except that there are specific conditions that are local to the country that would allow an effect to be shown in that case. But for me, it's just much more about looking at the evidence really deeply and making sure that the decisions that are made are based on the evidence here.
Thanks, Corinne. Neil, if I pass over to you as well. So I think there's also the you said nets, but there's different types of nets. So would you mind clarifying what nets have been used in the trials so far? Because there's also an evidence gap versus what tools are being deployed nets-wise today as well.
Well, oh God, I'm drawing a blank. In Indonesia, it was just normal delta methrin nets, pyrethroid nets. And I think in Kenya, was it PBO nets?
Yeah,
Yes,
that's
correct.
right.
Thank you. Phew.
I guess what I'm trying to allude to is that currently the tool that is most widely deployed from a nets perspective is also a chlorphenapir, dual AI, ITN, and so
Yes.
there is a potential for greater gain, or it's a real unknown, and so I'm saying gain, but maybe it won't be. Who knows? But spatial emanators on top of chlorphenapir nets, we don't understand that
Yeah.
impact either yet, do we?
Yeah. So no, we don't. So the important thing to realize is these different interventions have different modes of action, right? They function at different points in the transmission cycle, where and when they're actually exposed to, where and when they're actually exposed to the intervention, and where and when humans are exposed to the mosquitoes, right? They function at different points. And different kinds of nets might function differently based on the transmission system and what humans and mosquitoes are doing. So we'd expect them to function differently. Better, worse, we don't have that data set yet. Yep.
And that really draws an important point, because when we first in the ecosystem started talking about spatial emanators, we were actually talking about the repellency effect. Would you
Yeah.
mind quickly summarizing the different modes of effect that are seen with spatial emanators today?
Oh, absolutely. Yeah. So they were initially called spatial repellents because that was assumed to be the major impact. Mosquitoes that repelled from the area with the spatial emanator in there. And multiple people, including Corinne, have generated data that demonstrates that there are much more impacts than just repellency. For example, a mosquito might, first of all, they not just repelled, they might not feed, they might land and they may not feed, they may just go rest and not feed, they may get knocked down, they may die based on the amount of the active they're exposed to. And all these sort of impacts, I'm going to say secondary impacts, so they're not secondary impacts, all these impacts contribute to a reduction in biting and therefore community protection. So the impact of spatial emanators is actually more than just repellency. Yeah.
Thanks, Neil. Some of the dialogue is also around the mortality effect of spatial emanators. And so
Correct.
how would you, well, can we put a proportion of how much is mortality, how much is repellency or disarming? Are we there with that understanding yet, or is that something that we're going to hopefully get better understanding with in the future?
So it's very specific to the active, the concentration, the dosage that they're exposed to, and the mosquito species and strain, right? So we have data on some species, on some strains, but not all. And it's variable between them. And we see differences, definitely differences between them. Corinne, I think, has generated data on this as well. So perhaps, Corinne, could you comment on that?
Yes. Oh yes. The data is showing really all these multiple effects, the repellency, the deterrence. You also have mortality. Mortality is not as high as you would get with other types of products, especially ITNs, but it's reasonable. And we also see it even against highly pyrethroid resistant mosquitoes. So that's a good thing that really works for spatial emanators. But again, if you have to follow the guidelines, then based on what we have for the epidemiological impact, there is still a need to optimize by having them deployed alongside ITNs.
Thanks so much, Corinne. Now, if you don't mind, Corinne, we switch over to vaccines and try and get a mix as well, because vaccines are also a protective tool, and would really love to hear from you on the evidence that's out there. Can you summarize it for us, and what are the key findings that we want to have a front of mind when we're thinking about vaccines?
Okay, yeah, thank you. Yeah, I think it has been a discussion in the malaria community for a long time now. We've been hoping that a vaccine can come up, and WHO recommended 2 vaccines so far, R21 and RTSS. And this is really based on really huge evidence collected across multiple countries. Vaccines, when deployed, and especially in areas where you already have ITN coverage, you can reduce malaria cases by 50%. You can reduce severe malaria by over 20%. You can even reduce malaria deaths. So that's evidence that has been carefully collected. And yes, what really stands out about all of this is that a lot of it was done against a high background coverage with ITNs. So right now, there isn't really a clear reason to say you can just deploy them by their own and get the same impact as you did in the trials that led to their recommendation. So we don't have that evidence yet. But we also know that vaccines have these strong seasonal effects that if you deploy them in a period where there's a lot of malaria, then you can really reduce and benefit most from the vaccines. But they are also there to protect children, which is really very welcome. We welcome any intervention that can protect children because they are the most vulnerable. When we talk about deaths, we're always talking about deaths in children. So definitely they have a really important place in malaria control. I think the issue from the evidence that we are bringing out from the spotlight is that based on the evidence, you can't just say you're going to get the same effect if you deploy them on their own. So countries should know that, it's not because we now have a vaccine, then we stop doing vector control, we stop providing nets to people, that every sort of decision should be taken with that in mind.
If you don't mind, could you tell us what are the important things to remember when you're thinking about subnational tailoring? Because there isn't an infinite amount of funding, and countries don't have the level of resources or support that they had when they were thinking about these interventions and deploying their strategy. So what should one consider when thinking about deploying vaccines in their countries?
Yeah, for subnational tailoring, yes, you want to go with the evidence that you have, the situation that you have at hand. I think countries are encouraged to collect as much data as they can, data on the vector species that they have so that they can know what to deploy on the number of malaria cases. Where you have children really dying, I think those are areas that you want to really target with vaccines, but also you have to bear in mind the evidence that exists, the epidemiological evidence that we have, which shows that you can really have optimal impact when you deploy the vaccines alongside ITNs. That's the communities already have ITNs, and then you deploy the vaccines. So I think these key points should be considered as countries develop their subnational tailoring plans and making sure that they're getting optimal impact from all these interventions across the different ecological zones that exist within the country.
Thanks, Corinne. And then the other thing to bear in mind, and this is applicable to both spatial emanators and to vaccines, is that we are still in this moment of evolution and data generation, but also development as well. That product development hasn't stopped for vaccines. And so what we know today may not be true of what is the vaccine that's being deployed tomorrow as well. So do you have any reflections on that?
Oh, yes. There's a lot of work going on for next generation malaria vaccines, which is really welcome. I think what we want is a vaccine that will give lifelong immunity instead of just lasting for a short season, where people are protected forever and then it's cheap and it can be easily deployed. So that's the ideal. And yes, we have a very resilient scientific community and there are people working on this. So it's a prospect, it's something that we hope for. Just the evidence right now, we're not yet at that point, but if people continue to invest in the science and innovation, maybe we will get there. And if vaccines come out to be the final answer for malaria, why not? That's something that we will all welcome. Yeah.
Neil, from your side, what are the key things that you want people to remember when thinking about spatial emanators, the tools that are currently PQ listed and available for countries to deploy, and maybe the limitations as well of what we do know and what we don't know as well?
Perfect. That's such a good question because malaria transmission is incredibly complex, right? The main point, I guess, for me is that we're looking at two completely different kinds of tools. And each one, for example, vaccines impact transmission in one direction, and vector control tools impact transmission in another direction, right? Transmission to humans and transmission to mosquitoes, because both sides have these reservoirs of parasites. And that's one primary reason why like some tools cannot replace another, because we're looking at transmission in different directions. Different interventions, even different vector control interventions, SCs versus ITNs, are function differently and completely different from vaccines. So understanding how these function together or separate in a specific environment, in a specific transmission system, is super important towards understanding how much they're going to protect people. So rather than competing with each other, these interventions address different parts of this transmission cycle, which can be completely different and complex where you are, depending on where you are. And from my perspective, the question is no longer like which intervention is best. It's which intervention or combination of interventions is most appropriate for this community. And this answer will completely differ depending on the mosquito behavior, on human behavior, on transmission intensity, on insecticide resistance, and importantly, operational realities, right? Can we get this to people? And that's why generating high quality evidence and data remains so important. And of course, cost.
Of course. And with that subnational tailoring lens, do you see that dialogue and that conversation ongoing with countries where they're trying to think, okay, where will I get the maximum impact? Taking your words now to say, okay, well, I've got spatial emanators being deployed, and then I want to see an additional boost with spatial emanators sorry, ITNs, and then a boost with spatial emanators. Do
Yeah.
you see that sort of dialogue ongoing, or does it need to be, does it need to happen more so?
I think the dialogue has started, it's ongoing, but it needs to be more so. And I think it's more needs to be implemented more so. It's really hard to have national strategies that like cater to different transmission systems in smaller areas. It's just difficult operationally. So how do we manage to do this effectively is a big question. People are talking about this a lot, and I feel they understand it and how it can be very cost effective and more protective, but actually getting it done to scale, I guess, just S&T scale, is pretty difficult.
Thanks. And Corinne, if I pass that question over to you as well for vaccines, and you've mentioned subnational tailoring and the importance of it. How much do you think there is that tailoring of where am I going to deploy vaccines to achieve maximum impact? Or do you think it's more about universal, I say that with some caveats, some widespread coverage of vaccines?
Yeah. Yeah. So a lot of countries that have started to pilot or deploy vaccines, mostly targeting the areas that are most important to them. Some are going to areas that have high malaria or areas where they can't deploy other interventions effectively. So I think it's really specific for each country and each region within the country. I don't know if we want to like say, okay, every child should just be vaccinated and all that. That's a different approach. But whatever we do, I think that evidence matters and the data needs to be collected to be sure that we're making the right decisions. So countries also need to invest in generating the evidence that they need to make sure that their subnational tailoring strategy is optimal, because they may end up just wasting resources. So if it's that you need to target vaccines in particular areas, then that's good for your country. You should go with that. So whatever works well for the country, I will be happy with it. Yeah.
What I'm hearing as an underlying theme is the need for countries to not just take recommendations and deploy on scale, but to generate local data to understand in their own context which mix works and which one doesn't work. And it's okay to make mistakes, because that's how, or make decisions that aren't as great as they could be, because that's how we learn, I think, as well, is also what I'm hearing. I always remind people that for example, your PhD, there's no such thing as a failure, because a chapter where you didn't show anything new shows you what not to pursue again. And so with this as well, it's, if an intervention mix didn't work as well, this is for you to learn and say, well, actually another combination may work better. But also there's a huge amount of background data to support that initial decision taking as well, is what I'm hearing as well from you. We're nearly at the time, because we only booked 30 minutes for a quick short tea break for everyone to attend. So if I can just quickly ask you to summarize just 3 key takeaways from the evidence spotlight that you've partnered with us on. So Neil, if I can start off with you for spatial emanators, 3 takeaways that you would like anyone attending this session to walk away with.
Okay. Well, the 3 takeaways would be: 1, spatial emanators work to protect against malaria, but they're over bed nets right now. That's what the evidence demonstrates. Epidemiologically, ITNs should remain the cornerstone. They are the ones with the most evidence. And as new tools emerge, we just need more data to demonstrate that they actually work in those specific circumstances. The second thing is that these new tools should be viewed as complementary at present and not competitive. Vaccine, spatial emanators, and ITNs work through different modes of action, and as I said earlier, and their value lies in how they work together rather than replacing anyone. Malaria control is becoming increasingly more about how do we intelligently combine interventions based on local needs. And the third thing is we need more evidence. We made tremendous, really awesome progress, but important questions remain. We need to better understand where spatial emanators provide the greatest value, how they perform against in different transmission systems, and how programs can optimize combinations of interventions. And we just need more data on spatial emanators alone in different target populations in urban areas, in areas with low ITN use, and continuing to build this evidence base will ultimately strengthen policy and improve program decisions.
Thanks, Neil. And Corine, if I pass over to you on your 3 takeaways that you want the audience to take away with them today.
Yeah, I think the first one is that vaccines protect children. So yes, we should make sure that we're using them where we can and where we have the funding to be able to use them, but also that this is a complementary tool. It adds on to vector control. We have seen vector control has reduced malaria over the years, so it should not come as a competitor. If not, we may be missing the point here, but rather we can find ways in which they can complement each other as much as possible. And for me, the third point is that vaccines provide both community effect. They go beyond the age that is covered by, ITNs. They go beyond the age that is covered by vaccines. So you can protect adults, you can also protect pregnant women. So you're having a bigger protection overall over the community. So for that reason, I think that it's very important that the vector control should continue to, especially ITNs, to be seen as the foundation. But also we are hopeful that more effective vaccines will come up one day, so that route should also continue the research, the innovation to bring us to that point. I strongly support it, and I really want that we get a vaccine one day. But for now, as the evidence shows, if we want optimal impact, then we must pull these tools together. We must make sure they are seen as complementary. Thanks.
Thank you so much, Corinne. I just want to say thank you so much to both of you for partnering with Vestergaard on these evidence spotlights. The intention from both sides was always that we want to be able to put out the evidence. Now, one thing I'd like to reflect on I'd like you to reflect on, what is the gap that you see at the moment that made you feel that developing this material with Vestergaard was particularly useful? And I open it up to, maybe we start with Corinne and then Neil. I'd really like to get your reflections on that.
Yeah, for me, the gap was that the information wasn't really clear. Some countries who were not really following the evidence sometimes thought, oh, now we have a vaccine, so let's forget about vector control and all that. And that's not the fault of anyone. It's just that some of this information is not being circulated as much as it should. So that's where I see that there was a need, and there is continuously a need to make sure that this information is very clear to country, that we are not competing, that there is no competition here, but we want optimal impact. And if we really want to eradicate malaria, then we must use all the tools that are available to us in order to achieve that goal faster. So I think that, to me, that's where I felt the need to support this evidence spotlight. Thanks.
Thanks, Corinne. And Neil, over to you.
So I think that malaria control is entering one of the most exciting period we've had in decades. We're seeing new vaccines, new generations of bed nets, spatial emanators, and several other interventions that are in the pipeline. This is great news, but it also means that decision makers, policymakers are being presented with far more information than ever before, as Corinne pointed out. And what malaria programs need, at least to me, are clear, balanced summaries of the evidence that explain not just what we know, but also what we need to learn. They need to understand how, where, and when these interventions function, as well as how they don't function, because that's super important, because where our interventions don't function is where every single one of our malaria cases come from, right? So that's what we need to understand in balancing out how well they work, how well they don't work. So these evidence spotlights help bridge these gaps, right? They bring together complex scientific evidence into a format that is accessible to program managers, policymakers, as well as researchers. So at a time when resources are becoming increasingly constrained, it's more important than ever that decisions are guided by evidence, right? We really don't have a choice. And these spotlights reinforce an important message. Continue investing in proven interventions, for example, bed nets, while carefully evaluating how newer tools, such as vaccines and SEs, can be layered on top to deliver even greater public health impact. Ultimately, I guess that's how I think we'll make the greatest and fastest progress towards malaria elimination.
Thank you so much. So we're at time. So thank you, Neil, and thank you, Corinne, for joining us. I hope everyone found this discussion useful and maybe gave some new perspectives. And yeah, look forward to our next session in later on in the year. Thank you so much, everybody.
Thank you. Bye, everyone.
Bye.